The next topic that we are going to discuss about regarding the posterior abdominal wall is the abdominal aorta. Abdominal aorta. So regarding the abdominal aorta, we have the abdominal aorta, the introduction, the relations, and we will discuss about the branches. So the first one is the introduction and the location. The abdominal aorta begins at the aortic hiatus. That's T12 vertebra anterior to the 12th thoracic vertebra, anterior to the 12th thoracic vertebra. It bifurcates into two common iliac arteries at L4 or L4-L5 intervertebral disc, slightly left to the midline. Begins at T12, bifurcates into two common iliac at L4 or L4-L5 intervertebral disc, slightly left to the midline. What is the diameter? In men, it is 19 to 20 millimeter measured by the CT scan and 20 millimeters by the ultrasound scan. In the women, 16 to 18 millimeters, 17 by ultrasound scan. But there are ethnic variations. It can change depending on the ethnicity. The diameter decreases slightly from the proximal to the distal. What are the age-related changes in the abdominal aorta? Increases in diameter with age and tapering becomes more pronounced. The aorta may become ectatic and tortuous in the elderly, altering the bifurcation angle and rotating the origins of the major branches. Increases diameter with age can become ectatic and tortuous with elderly and altering the bifurcation angle and rotating the origins of the major branches. Abdominal aortic aneurysms. 80% of it happens in the infrarenal segment. 80% happens in infrarenal segment. Men with atherosclerosis, especially after 6th decade, are at higher risk. The clinical cutoff for an aneurysm is the diameter of 3 cm. The treatment, open surgery or endovascular aneurysm repair. Now, what are the relations of the abdominal aorta? Superiorly, celiac trunk and its branches, autonomic nerve plexuses and lymphatics. Then, body of the pancreas, splenic vein, lesser sac, stomach, and the left lobe of the liver. So, superiorly, celiac trunk and its branches, autonomic nerve plexuses and lymphatics. Body of the pancreas, splenic vein, lesser sac, stomach, and the left lobe of the liver. Inferiorly, horizontal part of the duodenum crosses anteriorly, inferior part of the aorta. The horizontal part of the duodenum crosses anteriorly, and the small bowel mesentery origin. Is inferiorly. What about posteriorly? Posterior 12th thoracic vertebra, lumbar vertebra, L1 to L4, intervertebral disc, anterior longitudinal ligament, and the lumbar veins. The 3rd and 4th left lumbar veins cross behind the aorta to reach the inferior vena cava and may overlap the medial border of the left psoas major muscle. The right-sided relations. Cisterna chyli, thoracic duct, azygous vein, right crus of the diaphragm. Inferior vena cava lies closely from L2 downwards. Complication: aortocaval fistula, which are rare, results from aneurysmal disease or trauma. What are the relations from the left side? Left crus of the diaphragm, sympathetic trunk, inferior mesenteric vein, and the 4th part of the duodenum at L2. Then, branches of the abdominal aorta. There's anterior group, lateral, and the dorsal group. What comes under anterior group? Celiac trunk, superior mesenteric artery, and the inferior mesenteric artery. The first branch of the aorta arises below the aortic hiatus at T12. Trifurcates into left gastric, common hepatic, and splenic arteries. Those are the celiac trunk. The variants can be The separate origin of the left gastric artery, inferior phrenic arteries from celiac trunk. In the anterior group, the next one is the superior mesenteric artery. It originates 1 to 2 cm below the celiac trunk at L1, lies posteriorly to the pancreas and the splenic vein, anterior to the left renal vein, enters to the root of the small bowel mesentery. The variant can be accessory, replace right hepatic artery in 15% of the individuals. Then the inferior mesenteric artery arises from the aorta at L3, 3 to 4 cm above the aortic bifurcation, supplies the hindgut. The lateral group is the suprarenal arteries, renal arteries, and the gonadal arteries. Suprarenal arteries arise near the superior mesenteric artery, supply the suprarenal glands, anastomosing with the inferior phrenic and the renal. The right one passes behind the inferior vena cava, left one near the pancreas. Renal arteries are the largest lateral branches, rise just below the superior mesenteric artery at L1. Right renal artery is longer, passes behind inferior vena cava, renal vein, head of the pancreas, and the duodenum. The left renal artery passes behind the left renal vein, pancreas, and the splenic vein. The gonadal arteries arise just below the renal arteries, pass inferolaterally to the gonads, may arise from the renal artery or can be double. Now, that's the lateral group. The next one is the dorsal group. The inferior phrenic arteries arise from the aorta or celiac trunk, supply the diaphragm. Right and left bifurcates and give small branches to suprarenal glands. The lumbar arteries, 4 arteries on each side, arise opposite lumbar vertebra, posterior intercostal equivalents. It passes behind sympathetic trunk and psoas major. Originates from an upper lumbar artery, crucial for spinal cord blood supply. That's the artery of Admicuvix. The lumbar arteries, lateral branches, pierce the transversus abdominis to supply muscle and skin. The last one of the dorsal group is the median sacral. It arises above the aortic bifurcation, descends anterior to lumbar vertebra and sacrum. Anastomose with the iliolumbar artery and lateral sacral arteries. So they can ask, what are the anastomoses? It anastomoses with the iliolumbar artery and lateral sacral arteries. Then, the next main topic that we have to discuss is the clinical points of this lesson. Abdominal aortic aneurysm, common with atherosclerosis, especially after 60 years. Ultrasound screening should be done to identify this. The cutoff is 3 cm. Treatment is surgery. Rare complication of aneurysm or trauma, that's aortocaval fistula. These aortocaval fistulas forms between aorta and inferior vena cava. Those are the main topics that we have to discuss under this mind map. We'll see you with the next video. Thank you very much for watching the video.